What we see now is a public health paradox. As we get closer to zero, the fight becomes harder. The public no longer receives the same level of threat, and their support can wane. There has always been lack of government ownership. We have been relying on outdated methods, but thankfully, we are seeing good changes. Since the last campaign, for the last 6 months, they have started using the geographic information system mapping. It helped our teams estimate the houses right, and this helped reduce the vaccine wastage. There are funding cuts for Pakistan, and we can hope that political will is increasing. Communities are now facing campaign fatigue. When their basic needs are not met, they show hostility towards a program that creates hype for just one disease. And the most difficult thing is hiding children. This is due to gender insecurity fears in the north, where we have most of the cases this year. The most important change is the leadership. System you cannot fix. If your political will is increasing, that will bring ownership in the people also. I think now is a very good time where donors can also start building ownership with our leadership, with our government. In the past, the third parties were outsourced to operate Pakistan, and government was not taking ownership. The solution is a partnership where donors can build the trust with the government, and when our leaders will own it, this will inspire leadership in our own people also. Ethics is the gateway to building trust, and trust is the currency in public health. When people see your program as ethical and beneficial, they start cooperating. Respect, which is something mandatory, it has remained missing. We have used coercive approaches to meet our vaccination targets. This broke the trust of public. And now we see refusals more commonly happening. Our frontline workers, they are at risk of being killed because there is anti-polio narrative also. They are taking this risk for $3 per day, while those at top are perceived to live in luxury. And these risks, they are not fairly distributed. There was role confusion. Transparency was blurred. Accountability was blurred. Many of our top public health experts of Pakistan have often advocated for integrating this program with routine immunization. You can see integrated people-centered care framework. So WHO also advocates for shifting focus from disease-specific programs to integrated care that is centered around people, empowering communities to own their care. Adding more technology, that will help us with many things, especially the fake reporting. One of the biggest mistakes in the past that we have done was handling refusals non-technically. These kind of ways like BRSIM will be blocked are actually non-technical in health programs, because this program was in the hands of administration teams. Those people are not trained for handling kind of things. So this was not only unethical, it was non-technical. And we have better frameworks now. We have to address these refusals technically using scientific guidance. Last point, why the world needs to support. The math is terrifying. This program, though it was very successful in reducing cases from 350,000 cases to just a few now, but if we stop this, there will be 200,000 new cases every year. Was this a case of funding from Ministry of Health, Pakistan to fund alone? Our cost-benefit analysis shows that the cost is higher than the societal benefits gain. This does not justify the funding from Pakistan alone. And this is the case in global disease eradication programs. It is global public good. And while the risks are local, the rewards are shared globally. And this is why equitable funding from all countries, it should be pooled in some global health security fund. It's then a shared responsibility, not a charity. And it should come with strong accountability, guided by the principles that we have discussed. We need worker safety and fair compensation plans to reduce the risks in our communities. We need Polio Plus strategy to increase the community benefits. Polio Plus is the strategy that helped Nigeria also finish the job. In Polio Plus, you do not just bring one vaccine, polio, you bring it as a package of health service. This increases the benefit for the community, and they will be more likely to accept service. And lastly, we need care for our vulnerable populations with integrity. They should be heard, and they should have some channels for feedback. They should be having some channels for accountability. I invite you all to be the one who speaks up to ensure that our program not only achieves its goals, but it does that with integrity. And remember, your voice matters. Donors, we have influence, and we will be heard. And because our people were not heard, so I want to make them heard. I want to show you some images in a video to honor their sacrifice and acknowledge their efforts. This is the human cost of our mission. Let's honor them. Let's speak up for their rights. Let's support. Thank you so much.
Great update. So, just a couple of things. You touched on ethics. There's a few realtors in the room. We have to do an ethic upgrade every year, and along that line, it would be nice to see. It would be nice to know that the money we're sending over there is being used responsibly. When you donate to Rotary, you know that there's a team of people thinking about how that money is going to be used and what is going to happen at the other end of at the other end. So a good reason to donate through Rotary. Let's see. You touched on the technical aspects of getting the job done. So they're working hard in Pakistan to make it happen.